Hey, it's Dr. Birchler, and I have a picture on the screen up here of somebody's neck and the spine. And just yesterday, I had a couple conversations with a couple gals in this case, and I very commonly see people that have been in vehicle accidents. Sometimes they come to me shortly after their vehicle accident. That's why they're there. They have whiplash, they have headaches, they have neck pain, they have radiating arm pain, they have all kinds of problems that are common: back pain, pain in the ribs, those kind of things. But it's common for me to also see somebody who, just in the course of their taking their history and talking with them, they had a car crash some years back. And it always amazes me the amount of people that actually have not had chiropractic care after prior crashes. And I think there's some different reasons for that. Maybe they don't understand um, the necessity of it. Maybe they were concerned about cost and they don't understand the way insurance works, particularly in Pennsylvania, which is a no-fault state and has a minimum amount of medical coverage, even on the state minimum insurance policies. And then some people end up going to the ER or something like that, and they get their CAT scans and things, and they basically get told they're okay, but they're looking for bleeding on the brain and they're not looking for problems with your spine. They're looking for things that are broken, or whether your brain has had trauma and is bleeding. And so they end up maybe thinking, well, they told me I'm okay, and they don't do anything. And then fast forward down the road is what I'm going to talk about here for a moment. So this is an x-ray this is gals about 40 and having a lot of trouble with the neck and the back. And in this case, the neck should line up kind of like this green curvature here, but it's actually going backwards. And you can see that these are the glasses here. So this person's looking, at least as I'm looking at my screen, to the left. All right, you can see where their glasses are, and their neck should arc this way, but it goes backwards. And that can happen from this whiplash that happens, and the person's ligaments get damaged, and their spine heals in a crooked, misaligned position. And I'm going to zoom in on this, as I see this commonly, and it's a relatively telltale sign of a past vehicle accident, is if you look at this vertebrae up here, this is pretty normal. It looks pretty much like a square or rectangle, and it has a flat front and relatively distinct corners on it. You can see a similar thing down here, the top corner of this vertebrae. But then you look at these two vertebrae in particular, and here's the top, and then it looks like instead of it coming to a corner, like it's chopped off here, like the front corner is chopped off or dented. Same thing here, corner is like dented. And what happens is, a person's in a crash, and the spine has a hyperflexion injury, and the vertebrae essentially crushed together and damage the bone and the disc, and the bone actually is deformed on X-ray. And then in this case, these cushions here between the vertebrae are relatively normal. That's the space between them, called a disc. So that's normal, that's normal, that's normal. That's relatively normal. And then you get to this one here, and this person's only 40, so there hasn't been a lot of time for this to wear down, but you could tell that the thickness of this one relative to these up here, maybe it's 70 to 80%, and they're only about 40. So they probably wouldn't have told you, well, they have a degenerative disc in their neck. They probably wouldn't have thought that at age 40, but it's already occurring. There's already visibly spurring on the bone. They should be nice and smooth, and you have this white calcifications forming in the ligaments. You have the bones are misshapen and poking out to the front. You have these vertebrae that are dented. So all signs that there's been a trauma, and the spine is already decaying on the inside, and you may be unaware of that. Probably some signs, symptoms, headaches, neck pain, things in the body, and you may chalk it up to something else. Now, one of the other things that will be concerning in a case like this, and we see relatively commonly, is when the neck gets misaligned with this whiplash and it heals crooked like that. It causes the upper back to seem to protrude a bit and start to get a hump or a bump in the upper back, the upper part of the spine. And of course, nobody wants that, but there's just a cause and effect correlation to some extent with that neck going backwards and crooked from a vehicle accident, and then that upper spine starting to flex and get a hump or hunch to it. Now, those things aren't always 100% correctable. I understand that life happens and some things are never going to be perfect again. My job is really help get them as good as you can and minimize the long-term negative health consequence, the long-term pain, but also some of that age-related deformity that occurs after a trauma, in this case a trauma like a vehicle accident. My advice to you, if you've been in a crash, whether that's certainly if it's recently, get checked right away for 100 reasons. If it's been something you've dealt with years past, you had a crash and never been checked out. Some of these things you wouldn't know because you don't know what to check for. You don't have anybody take a picture of it. The best time to do something is before it's decayed, before it's worn down, because nobody can make it new again. So you want to be able to arrest it, stop it as soon as possible, fix whatever can be fixed so you can have the best life you can.